Hi, I'm Sarah Stacey. I'm a clinical psychologist working with drug and alcohol services in Bristol City. So working for an NHS trust, but we work in partnership with two third sector organisations as well. So one of the things I love about clinical psychology and my job, I guess particularly, is that there isn't a great deal that's typical. So I'm not a psychologist who does lots of therapy kind of day to day. So a typical day might look like seeing one or two clients for one-to-one therapy. So I'm particularly interested in trauma-focused work. I will also probably have some time supervising other practitioners or offering reflective practice sessions. There would usually be some kind of meeting about service things, kind of planning new interventions, service development. And if I remember and try to plan it in, hopefully there'll also be a little bit of time for research or CPD, kind of keeping up to date with relevant papers, trying to look for training courses that help me to develop my areas of interest. And then probably the kind of normal day-to-day stuff, catching up with the ever-growing mountain of emails and, returning calls and just trying to keep relationships with people going, which is, a bit tricky at the moment in COVID times. This is a really difficult question to answer because there are loads of things that I enjoy and some things that are frustrating. But I think broadly, it's the opportunity, the privilege, I guess, to support people and to work with people when they're, at a really low point in their lives, or, with colleagues to really think about developing and supporting people to learn and think more about psychology. I guess it's a bit of a license to be interested in lots of different things, and that's a great thing to have. So I studied for an A-level in psychology, which was kind of where my interest started, then did an undergraduate degree in psychology at Exeter. After that, I worked in drug and alcohol services as a support worker for about 10 years or so, then decided that I wanted to pursue clinical training at that point, really. Worked as an assistant psychologist for a year or so, and then applied for clinical training, was fortunate getting on in my first try. And then, 3 years of training later and a few jobs, here I am now. Any NHS work experience is always valued because clinical psychologists train in the NHS. Our training is paid for by the NHS. So experience of working in the NHS is really important. Working with the populations who clinical psychologists work with in a vaguely psychological way. So thinking about children and young people or adults or people with a learning disability, and having some sort of contact with those people in a psychologically informed way can be really helpful. But that could be working as a support worker in accommodation for people with learning disability. It doesn't all have to be assistant psychologist work. I think experience in research or something similar, experience conducting audits, just a familiarity with the two aspects of the clinical psychologist role is really important. Remembering that we're clinicians and we're also scientists, there's kind of scientist practitioner balance, thinking about how people can represent that in their work experience.